So I am Susan Trump, the Hospice Ancillary Supervisor. And today we are doing, this is for the June 2017 in-service. It's customer service in healthcare. I'm going to open it to the first page. Customer service in healthcare. Healthcare is a very personal business that focuses on service, not on things. For example, if Mrs. Lincoln spends money on a toaster, what does she get? Hopefully she gets a toaster that works. But if Mrs. Lincoln spends money on a nursing assistant, what does she get? She's buying the service of a trained healthcare worker. If those services are provided to Mrs. Lincoln as ordered on time with a smile, then that's good customer service. Mrs. Lincoln will probably feel that she has spent her money wisely. When people receive medical services, they may not understand all the technical parts of their care. For example, Mr. Dawson may not understand why he's hooked up to a monitor and how his medicines work. But he will understand that his nursing assistant brought him an extra pillow and helped him comb his hair before his wife's visit. So remember, you don't have to be a doctor or know how to operate fancy machines to help people feel better. All you have to do is give great customer service. Customer service is having a fresh approach to each of your clients and your coworkers, because everyone is an individual. Finding new ways to do things better all the time, working to solve problems as soon as they come up, keeping a positive attitude even when you're having a bad day, and treating your customers like they would want to be treated if you were in their shoes. Who are your customers? A customer is anyone who expects something from you or has needs that must be met by you. This includes two main groups of customers. Internal customers, those are your coworkers, including every employee at your workplace. And external customers, this group includes everyone else who you come into contact with at work, such as your clients, their family members, and visitors to your workplace. Even a neighbor who asks you about your work is a potential customer. Whether you are dealing with an internal or external customer, your goal is the same, to put yourself in the customer's shoes. Okay, let's go to the next page, page 3. What do your clients expect? What do you think when you drive by a hospital? As a healthcare employee, you probably think about work. You may ask yourself, would that hospital be a good place to work? Or I wonder if they have any job openings. Think that way. Or I'm glad I don't have to work night shift anymore. But when non-medical people drive by a hospital, their thoughts are very different. They might think, I hope I never have to be a patient there, or that's where my mom died. They might also imagine themselves sick and in pain or dying. What has this got to do with customer service? Remember that your clients have learned what to expect from healthcare workers based on their past experiences. For example, last year, Mrs. Brown had surgery. While she was in the hospital, a nursing assistant promised to help her to the bathroom, but never did. Mrs. Brown wet the bed. This experience means that she may not trust the next nursing assistant that takes care of her. Or Mr. Nelson used to have a home health aide that ironed his clothes for him, even his underwear.
Lucky man.
Now, you probably expect that every home health aide will do the same. Part of your job, if you want to give great customer service, is to find out what your clients expect from you. Remember, most have some basic expectations, and they expect to be safe and comfortable, and they expect you to do what you say you're going to do. The more often you meet a customer's expectations, the more that person will come to trust you. The price of poor customer service. Sarah was once mistreated by a clerk at her local grocery store. Even though she had been shopping at the store for 3 years, she went so often by the incident that she switched to a different supermarket. 12 years later, Sarah returned to the original store and decided to tell the owner, Tom Benson, what had happened. Tom listened carefully, apologized, and thanked her for coming back. Then Tom sat down with his calculator and he figured out that Sarah would have spent at least $25 a week in his store. Over the past 12 years, that would have added up to $15,600. Since Sarah probably told 10 of her friends not to shop at that store, Tom lost business worth more than $150,000 because of one incident of poor customer service. Remember, one bad incident can have a real impact on your workplace. Okay, let's see. I'm just going to read the responsiveness on the next page, on page 4. Most people think about 5 different qualities, including one of them is responsiveness. If there is a problem, how quickly do you take care of it? For example, with your internal customers, which is your workplace, if your supervisor tells you that your documentation is unfinished, how long would it take you for you to get around to fixing it? Took a long time, that's bad service. On your point, apart as being an employee. And then, for example, if your client tells you that she got the wrong lunch tray, how long would it take you to get her a new one? That's bad customer service or good customer service for your patient or their families. Okay, let's go to page 5, providing your clients with good customer service. Make an effort to remember your clients' names. Let's face it, you've probably seen your client's rear end. It would not be rude to remember their name. Don't be afraid to ask, is there anything else I can do for you today? You may have a bunch of clients who need your attention, but each client deserves to feel like they're the only one, at least for a few minutes. When you are with a client, give that person your full attention. Have you ever thanked your clients for trusting you to take care of them? Or told them that you enjoy having them as a client? If not, maybe you should. People like to feel appreciated. Think of all the choices your clients may have given up, including when to eat, what to wear, when to sleep. Offer your client as many choices as possible to help them feel like they still have some control over their own lives. They'll be more satisfied. And that would be like, what would you like to wear? Would you want to wear this? Do you want to wear that? That may be the only thing in their life that they can have a choice with, and they look forward to, I'm sure, for you to come in and give them that opportunity. We've all heard the saying, the customer is always right. Well, that's not exactly true in healthcare. For example, your client may tell you that he's supposed to have milk with every meal, but in his chart you see that he's allergic to dairy foods. Or a client may want to walk to the bathroom by herself, but you know that if she does, she'll fall down. So think of it like this. The customer is always right, but as long as it doesn't involve a health or safety issue. Let's go to page 7. What about customer complaints? No matter how terrific you are at your job, some of your clients are bound to complain at times. Some complaints happen because of employee mistakes, but many complaints are really just misunderstandings. For example, Mary is a home health aide who is scheduled to visit Mr. Smith at 10 a.m. Monday through Friday. On her first visit, Mary tells Mr. Smith that she'll see him on the same time every day. Mr. Smith thinks that every day means Saturday and Sunday too. He calls to complain that Mary didn't show up on Saturday. Try to be grateful for all your complaints. They give you the opportunity to clear up any misunderstandings and to learn from your mistakes. When it comes to complaints, the problem may be less important than what is done about it. For example, if nobody from the home health agency gets back to Mr. Smith about why Mary didn't show up, he may become more upset and angry. However, if the nursing supervisor calls him and explains that his family plans to help him on the weekends, he'll probably relax. Some people are more afraid to complain or they don't want to seem difficult, or they don't know who to talk to about the problem. Make sure your clients know how to make a complaint. It's one of their basic rights. If a client makes a complaint to you in person, stay calm, don't get upset or argumentative. Just listen to the client's story and consider that he may be right. People who have their complaints resolved to their satisfaction are usually more loyal than customers who have never complained. Responding to a customer's complaints. Be sure to focus on a client's problem, not his personality. For example, Mr. Baldwin is often grumpy. Mrs. Baldwin, is often grumpy, and when she complains about her food being cold, it would be easy to brush her off as just being grumpy. That wouldn't be fair. Be sure to apologize to clients after they've made a complaint, even if you've done nothing wrong. For example, Mary really didn't make a big mistake with Mr. Smith, but she should still say, "I'm sorry, I didn't make it clear to you that I wouldn't be coming on Saturday." Follow your workplace policy for how to report and document and handle complaints. And remember that a complaint can be a great learning experience. Let's go to page 9. To provide great customer service, listen up. It's important to practice your listening skills if you want to give great customer service. Remember to listen to what your customers are saying and to what they're not saying. Some clients may come right out and tell you that they need what they need, and same goes for your coworkers. You may have to listen to their nonverbal communication, such as their body language, to figure out what they expect from you. Listen without interrupting. Most of us have the bad habit of butting in when other people are talking, and even if we don't interrupt, we spend the time thinking about what we're going to say next rather than listening to the other person. If a client or coworker starts their sentence by saying, "I'm sorry to bother you," let them know that you don't consider them a bother. Try saying, "I'm never too busy for you," or some other nice remark. Think about how your words will sound before you say them. Even if you don't mean to sound negative, you might. For example, if your boss asks you where a coworker is, you should say, "I have no idea." Or you could say, "She was at the nursing station 5 minutes ago." The second statement is a nicer way of saying that you don't know. Listen to yourself when you speak. Then ask, "Would I like it if someone spoke to me that way?" Let's go to page 10. We just got a few more paragraphs. Under customer service tip, I'll just kind of move through a couple of them. Watch for nonverbal signs that a coworker needs help. Some people aren't good at asking for help, even when they need it. So keep an eye out for your coworker who is struggling and who looks stressed out, and lend a hand if possible. Never say to a coworker, "I'm only a nursing assistant." Remember to give yourself the same respect that you want from everyone else. Try to follow your client's preference as much as possible. For example, if you cook for Mrs. Brown and she tells you that she likes her eggs scrambled, remember to fix them that way. Or if you know that Mr. McMillan likes to watch the news at noon, remind him when it's about to start. Or if you know that Betty prefers 2 blankets on her bed, be sure to make it that way. If you find it hard to keep track of all of these things, your clients like to get, you might want to get a little notebook to fit in your pocket and write it down, your client's preferences. Stuff like that, that's the reason we get the phone calls. "I want so-and-so. Can this one come back?" Not, they didn't like the others, but the other one remembered their preferences and they really like them. So just remember that. You always want to be the one they ask for, right? Yeah. First impressions are important, but so are last ones. Think about it. You and Mrs. Thomas have a pleasant time together all morning. You've just finished her care and are ready to leave. She asks you to help her move to a different chair. You tell her that you don't have time and leave. What do you think Miss Thomas will remember? That you spent lots of time helping her with her bath and her hair? No, she'll remember that you refused to help her to another seat. So end each session with your clients on a positive note. On page 11, even more customer service tips. Remember that people from different cultures may have problems communicating with each other. For example, you may feel that people who won't look at you in the eye can't be trusted. Yet your client may come from a culture that is offended by direct eye contact. Be patient and open-minded when working with them or caring for them, people from other cultures. Show respect to your coworkers. Try to resolve problems directly before reporting them to your supervisor. For example, if you have a problem or disagreement with another nursing assistant, try to talk it over with that person. If the two of you can't solve the problem, tell your coworker that you are going to discuss the issue with your supervisor. Then it's no surprise. Be sure to explain to your clients what's going to happen next. Remember, you want to meet their expectations, so it helps if they know what to expect. Try to keep a balance between staying on schedule and getting your work done on time and being flexible so you can respond to each client's needs. Sometimes keeping this balance can be the hardest part of your job. When speaking to either a client or coworker, put yourself in their level. For example, if you're talking to a client who is resting in bed, sit next to the bed instead of standing over it. Be specific when telling someone you'll be back. For example, if a coworker asks for help and you say, "I'll be there soon," you might think that's 10 minutes is soon, when your coworker expects you to show up within 2 minutes. How many times does that happen? You call your patient and say, "I'll be there in a little bit." You think a little bit is an hour, they think a little bit is 10 minutes. So be specific. I will be there at noon. I will be there at 1. So there isn't any miscommunication. Keep a smile on your face as you go throughout your day. A positive attitude can have a great effect on your workplace. And that is it, people. So if you go to the back page, almost forget. And let's go through the questions. Let's see how much you're listening, because I hit every topic. Mrs. Simpson fell and broke her leg while she was taking a walk with another nursing assistant. To give her great customer service, you should A, make sure she always uses a wheelchair. B, give an extra dessert at dinner. C, be patient if she says she's afraid to walk with you. Or D, keep her in bed with the side rails up. C, correct. If you put yourself in Miss Simpson's shoes, you should realize that she may be afraid to walk with you, even though you weren't with her when she broke her leg. Be patient and give her time to trust you. True or false? Internal customers are more important than external customers.
False.
False. All the people you work with, both clients, external, and coworkers, internal, are important customers. Number 3, if you are responsive to a client's needs, it means that you, A, solve problems as quickly as you can. B, are able to put yourself in the client's shoes. C, know what you are doing. Or D, always wear a clean uniform. A, if you're responsive to a client's needs, that means you solve problems as quickly as you can. Being responsive means that you take care of your client's needs as quickly as possible. If problems come up, you solve them right away. Okay. Number 4, true or false? It's poor customer service to say negative things to a client about one of your coworkers. What's the answer?
True.
True. That's right. Speaking negatively about a coworker or client is bad customer service, Vincent. Number 5, if a client complains about something you did, you should A, ask your supervisor to assign the client to someone else. B, ignore the situation until it blows over. C, tell the client you were just following orders. Or D, tell the client you're sorry that he is upset.
D.
D, that's right. It's always best to apologize to the client even if you don't think that you did anything wrong. Sometimes they just want to hear, and I'm sorry.
Well, D.
So number 5 was D. Number 6, to improve your customer service skills, you could A, give your clients whatever they ask for. B, practice listening carefully when your client speaks. C, work overtime every day. Or D, call your clients by their first name.
Practice.
B.
B, listening is an important skill that often requires practice. So number 6 was B. Number 7, your clients have the right to be told how to make a complaint.
Yes.
True.
True. Knowing how to make a complaint is a client's right. Make sure your client knows to call if they have a problem. True or false? Knowing the personal preference for your clients and coworkers will help you provide excellent customer service.
Yes.
True.
Number 8 is true. The more you know about your customers' likes and dislikes, the better customer service they will be able to provide. Number 9, true or false? It's best not to tell your clients when you'll see them next, so they won't notice if you're late.
That's a double-edged sword.
That's false. That's correct. False. Number 9 is false. Clients have the right to know when to expect you, and it is good customer service to keep your clients informed. And number 10, telling someone that you'll be there soon may lead to a misunderstanding.
Yes.
True. The word soon means different things. Avoid misunderstandings. Better to be specific, like saying 10 minutes or at noon. So please make sure you put your name, first name, last name, date. Today's June 27th. Sign it and fill out the back. Are there any questions? No? Okay.